Aortic stenosis, in its early stages, doesn't usually give many symptoms. And actually, as the valve gradually narrows up, there may be a prolonged period where that patient has no symptoms at all. But when they do get symptoms, or if indeed their heart muscle starts to beat less strongly, that's a clear indication to go ahead to surgery.
There is no other way of diagnosing cardiac disease apart from taking a proper history and examining with stethoscope. And then you decide what's the next step in the management of that patient. And I would look for breathlessness, tiredness, palpitations. And if the patient have those symptoms, then I will go further asking about any faint or collapse or chest pain. Because if I have a patient with advanced critical narrowed aortic valve, there's no blood to come out through that aortic valve to supply the coronary arteries or the brain. So the patient will get chest pain despite they have perfect coronary artery, and they may faint because there's not enough perfusion to the brain. Just to check your blood pressure? We GPs are artful in screening, so we ought to think about aortic stenosis as screening for that condition. In my personal experience, I take a new patient registration as an excellent opportunity to examine a patient. The patients coming for health screening, what we call NHS health checks, patient aged between 40 and 75, and when we're doing the flu campaign. During the flu campaign, we come across a large number of patients aged over 65. I'm talking about hundreds of patients. So this is the right group where this disease could be quite prevalent. So these are opportunities which really should not be missed. Because after all, we're the gatekeeper, we're the first port of call to those patients. And if a patient makes the effort to come and see me, booked an appointment, took the time, I would like to pay them back. And I think I would not feel I've done my job if the patient walked in with a problem, left my room with the same problem and diagnosed. I failed that patient on the day.